So, having had my mammogram on the 28th of December, the following week I received a letter from the South West London Breast Screening Clinic asking me to go for further testing. Now, when you're asked to go for further testing, and you bear with me because I'm reading this happens to 4 in every 100 women. And unfortunately, I was one of the ones that got called in. So I go along to my appointment at the hospital in Tooting near me, and they take me into a little room and show me a picture of my mammogram. So they show me the areas of concern. They don't mean anything to me, obviously. And then they ask me to lie down and put my hands above my head. First thing they do is they go over the breast that is a concern with an ultrasound machine. Now, this isn't particularly pleasant because they use a lot of pressure as they're trying to find the areas that they want to have a good look at. When they found the areas, they then decide whether they're going to do a needle biopsy or not. In my case, they decided that it was definitely necessary. So the next thing they do is they inject your breast with a local anaesthetic, and then they make a small cut and push a needle into your breast. You're awake the whole time, but you don't feel anything except for pressure and pushing. It's absolutely fine. The only thing that is probably a little concerning is the noise the machine makes when it takes the biopsy from your breast. It's a very loud clicking sound, and when you're in a small room and there's no other noise, it's very amplified. So I had 3 biopsies taken and 2 markers placed. And then I had to go back and have another mammogram done to make sure that the markers were in the correct place. Having had the biopsy done, it's not very pleasant to go back and then have your breast squeezed and squished between plates, having another mammogram done, but it is necessary to make sure that the markers were in the correct place. Now, I had to go through 3 more biopsies like this over the next 3 weeks. And by that point, my breast was looking like a rainbow, and was very sore and very tender. But we got through it, and you will too. It is just a small procedure. If you have to have one, good luck.